According to a new survey from the Pioneer Institute, consumers still have some trouble getting straight answers about the cost of health care. These answers are required under a state law. To tell us about the survey is our guest from the Institute, the Senior Fellow in Healthcare, Barbara Anthony. Thank you very much for being with us, Barbara.
Great to be here, Chris.
First of all, talk about that state law. What exactly does it say?
Well, the state law is a pretty simple law. It's not even a long law. And it basically says that consumers have a right to know the cost of a healthcare procedure before they get it. And they can get that information from insurance companies or from providers, meaning doctors, clinics, dentists, hospitals. And they have the right to that information. How much is it going to cost me before I obtain the service? And that's basically what the law says.
So you wanted to see how this law is working. You did a survey and you looked at certain kinds of specialties. So
Right.
What did you cover in this?
Well, what we did was this. We did look at different kinds of specialists. And the reason we did that is because there's another survey that came out back in March from a New York organization called Public Agenda. And that survey was a national survey. And that survey showed that 40% of the people they talked to wanted to know the cost of going to a specialist before they went. They would have liked to have known that information. So we picked 3 specialists. We did dermatologists, ophthalmologists, gastroenterologists, and then we did dentists also because they're covered by the law. And those, dental, dermatology, eye doctors, ophthalmologists, gastroenterologists, routine screening, colonoscopies, very, very common. These are all very common specialists that people go to all the time. That's why we pick them.
So what did you find out as far as your ability to get a straight answer?
Yeah, well, that's... it takes a great deal of hard work, perseverance, and diligence, and patience for an ordinary consumer to get an answer from the healthcare industry in terms of what the cost of a procedure is going to be before you get it. And what are the results, I think, were very disappointing. And for the following reasons, Chris. This law has been on the books now since 2012. It became effective for most providers and carriers, insurance companies, around January of 2014. We're now in August of 2015. And I can tell you that at least half, we called about 100 different doctors around the state. And we actually called about 22 hospitals a couple of months ago. Half of these providers, when we called their offices and their organizations, had no knowledge of the state law. Kind of treated you like you had just landed from the moon asking a question for a particular procedure. So we think there's a lot of education that has to be done for front office staff or administrative staff, wherever you're going to put this function, because people in these offices who are serving the public are not being trained or taught by their organizations that this is a state law and people have a right to the information. Secondly, we found that there was really very, 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 very poor systems set up within hospitals or physician offices or physician practices for consumers to get the information, because the people who answer the telephone, even if they want to be helpful, they don't have the information to give to you. They don't have price lists. Or if it's a big organization, they're not quite sure where to send you to. So a lot of training, a lot of education has to be done. And we have some good stories too. I don't want to be all, I don't want this to be entirely a pessimistic result. There were physicians that their offices were able to give us information very easily in terms of the price of a procedure. And that was very heartening, because if some can do it, some can train the staff and get the information and actually treat consumers courteously and in a professional way when you call, then I think that everybody should be able to do that.
Well, one troubling trend in what you found is that if you go to a dentist, you're more likely to get a straight answer, because most people have to pay out of pocket for a larger share at least. But when you go to these other specialties, it's part of what you get in the larger health plan, so there's more opacity.
Well, that's true. Dentists, their offices are used to talking to consumers about, as you said, exactly, because we pay a lot of out of pocket for our dental care. So the prices are not secret in the dental world, and they are more transparent. But what we found when we went to, say, dermatologists, for example, first of all, not a lot of their offices were aware of the law. Secondly, instead of giving us an estimate of, what we asked for was the price of a basic exam. Let's assume that no further medical procedure was necessary. So all I want you to do is look over my body, look at my skin. And what we were given ranges in many cases, and I mean broad ranges, $85 to $400. Well, tell me what's going to make the difference whether I pay 85 or 400? And what we found is that we really weren't getting answers. Answers were like, well, it depends what the doctor sees. Well, okay, but what if I want nothing further done, no biopsy, no further treatment? Apparently, if the doctor sees nothing at all, except perfection, what we deduced is that that's where the base price is. But if the doctor should see something and has to write it down, that becomes another diagnostic code or something, and the price is changed. So if that's the way the pricing system is, then I think consumers have a right to know that, so that before you walk in, you have some understanding of what it's going to cost and why. And one other thing I want to say about this is one of the reasons why we're doing this, why the state law is important, and why it should be implemented and embraced, is that there are so many hundreds of thousands of people in this Commonwealth with high deductible health plans. You can pay anywhere from out of pocket $2,000 to $6,500. I mean, the days of feeling, health care is free, my insurance company pays for it, I mean, that was always a foolish idea, because we all paid increases in premiums instead of getting increases in our salaries. So we are paying more and more out of our own pockets. And that's why knowing the price ahead of time, not for emergency procedures, obviously, but for things that can be planned ahead, are so important.
It seems we have a long way to go between knowing the price from one provider to being able to compare, like with those apps for air travel. I mean,
right.
Isn't that what we really need eventually?
Well, yes, we do. And there's one of the things that insurance companies do is they have cost estimators for their in-network providers. So if you have Harvard or Blue Cross, whatever it might be, you're supposed to be able to go to that cost estimator, if you're a member, and see the different prices for the in-network providers. Now, it's not an app. I mean, you have to sit down at your desktop and you get in your password and so on and so forth. But I think that you're talking about the direction that this is all moving in. I just saw yesterday that Yelp is putting out reviews now for 4,500 hospitals across the country. Now, this is, we are really at the frontier of a brave new world here in terms of saying, healthcare is very, very important. It's probably one of the most important things that we use as consumers and patients. And we have a right to information about the quality, about the price, about outcomes and things like that. And so, we're still at the threshold of this, but I think it's going to move very quickly from here on in.
Thank you very much for being with us.
Thank you. It's great to be here. Thank you, Chris.
From the Pioneer Institute, Barbara Anthony. In a moment, we'll tell you about an event in Roxbury on the workings of city government, but first, this message.